Welcome back. Now, it is a worrying time for many of us, and the coronavirus is at the forefront of most of our minds these days. Well, we're hoping to ease, or at least help ease those worries and concerns for you this morning.
Indeed we are. A lot of you have been sending in your questions on the coronavirus, and here to answer them is GP Dr Matt O Toole. Good morning to you, Matt. Thank you for joining us.
Thanks for having me.
We have loads of viewer questions and we'll try and just bounce through them as fast as possible.
Yep.
But one of the really important messages that you want to put out there today, and I think anybody in your shoes wants to get out there, is to tackle the issue of fake news on social media, particularly around medications people are talking about.
Yeah, I suppose one of the commonest kind of calls we're getting from patients at the moment is patients are reading a lot of misinformation on WhatsApp and Twitter. I think more concerningly, people who maybe don't have access to social media, so those that are a bit older, are getting phone calls from their loved ones saying, look, Mum, I'm just after reading a tweet or something on WhatsApp, you should stop taking, at the moment it was your anti-inflammatories, it was some of your blood pressure tablets, and we've had really good guidance from this. We've had guidance from the HPRA, who regulate the medicines in Ireland, from the College of GPs, the College of Physicians, and the advice at the moment is that no one should stop their medication, that there's no evidence that any medication that people are taking at the moment can harm you or increase the risk of you getting COVID-19. So what I plead with people to do is, firstly, not to share misinformation unless you know it's from a verified source. And really the only two verified sources we have are hsc.ie, hpse.ie, and if you have a specific concern around your medication, just ring your GP. But please don't stop your medication, because it'll cause more harm than good.
We were talking earlier on with Sinead in Spain about the new figures that came out yesterday, and we were talking then before we came on air about your figures in terms of how it's affecting your surgery. And I think it's important that people know that the volume of inquiries and calls that you guys are dealing with in a run-of-the-mill surgery in Dublin. Yeah,
so I suppose we're a 6 GP practice, and I mean the numbers of COVID-related calls we're getting, I was just talking to our practice manager last night about this, and she's been documenting the calls. We're getting about 2,000 COVID-related calls a day, and 600 requests for testing. So what we're asking people to do is to bear with us. There's only 6 GPs in the practice. We'll do our best to get back to as many calls as we can, and to contact everyone that is requesting a test, but that does require either a phone consult with the GP. There's only so many hours in the day, so to bear with us. We'll try to get to the urgent ones as quick as we can, but yeah, we're under a lot of pressure, definitely.
Okay, well, look, let's try and get through some of the questions that people might be trying to ask you, I suppose. Are the symptoms one or more?
Yeah, so I suppose the symptoms, and this is important, the symptoms really at the moment are fever, which is the commonest symptom, cough, shortness of breath, and flu-like symptoms. They're the top 4 commonest symptoms. And if people develop those symptoms, then the advice is to ring the GP, and if you have those symptoms, we will organise for you to get tested.
And when you say flu-like symptoms, aches, pains?
Yeah, generalised aches and pains, fatigue, tiredness, yeah, they're the commonest ones. But again, fever is the most common, followed by cough, followed by shortness of breath, and followed by flu-like symptoms. They're the top 4, really.
Okay. Patricia wants to know, can you get the coronavirus twice?
Good question. So the coronavirus has only been around for 3 months, and it hasn't been around long enough for us to actually be able to answer that question. So at the moment, what we're saying is we just don't have enough information. We know that the virus of families, that you can get them twice, and there's a possibility if you have an impaired immune system that you may be able to get it twice. But at the moment, we just don't have enough information to answer that. And we're saying in all likelihood no, with the caveat being if you have an impaired immune system, there is a possibility you could.
Okay, very honest. I was wondering, when you contact your doctor about the test, how long you're waiting. So what's the window between looking for the test and actually getting the test?
Yeah, so there's 3 categories. So healthcare workers are getting tested really quickly, because we can't afford to lose them. So healthcare workers are getting tested in the most part within 24 hours. Urgent people, so people who have cancer or on chemotherapy or who have a compromised immune system, are being tested within about 2 days. And then other people who just have the symptoms but are well are getting tested between 3 and 5 days. Okay. And the turnaround time for result is at the moment 2 days.
So there is a very clear hierarchy?
There is, yes, absolutely. And it'll take about 2 days once you have the test to get your results.
Okay, Matt, Anne has a question here which touches briefly on what you just said in your previous answer. She wants to know about her own daughter. How long after chemo finishes does her immune system return to normal? She finished it 9 months ago. She's 31 years old. Is she the same low risk as any other 31-year-old at this stage?
So I suppose without knowing Anne's daughter and without knowing the cancer and the chemo that she had, as a general rule of thumb, 6 months after finishing your chemotherapy, and as long as you've had a normal set of bloods so that your white cell count is normal, you're considered to be the same as other people.
Okay, so that's 6 months.
6 months.
Okay, well, she said she finished it 9 months ago. So,
good. Yeah.
Okay.
Worried mum-to-be, does anyone know what the risk is for pregnant women, and are their babies more at risk?
Yeah, so we're lucky in Ireland actually that Holles Street, the National Maternity Hospital, is really leading the way on this, and they've just published a really good set of guidelines yesterday on this. And actually, what we're seeing at the moment is that pregnant women don't seem to be at higher risk of getting COVID-19 and don't seem to be developing complications as a result of COVID-19. Now, that said, it's only been around for 3 months, so we haven't got a huge amount of data on it. But the advice we're giving to pregnant women at the moment is anyone who has been pregnant knows that we advise them to get the flu vaccine. And the reason we do that is they are at increased risk in some cases of developing complications from the flu. So what we're advising our pregnant women to do in our practice basically is, if they can, to work from home, take the same precautions as everyone else. But at the moment, the research is actually showing that it's quite good and not actually causing adverse impacts on unborn babies, on newborn babies, or on pregnant women.
Okay.
And the very next question, Selena says, I have a newborn and I'm very concerned for him on the impact of coronavirus. Any advice?
Yeah, so with the coronavirus, the one thing we do know is that the single biggest risk factor that decides whether you become unwell from this is your age. And actually, newborns, kids, people under the age of 18 can have coronavirus and have no symptoms at all. So I suppose one of the good pieces of information we've got from Wuhan is that children are not being affected by this, which is good. The downside to that is that they are spreading it. So you can have it as a child and not know you've had it. So what we're saying to parents is, look, this is something that really isn't going to affect your child, which is good news. The downside is you need to be extra careful with your child because your child could spread it. And that's why one of the key messages at the moment is, please don't ask your grandparents to look after your child because they may have the coronavirus and have no symptoms.
Even know.
Yeah.
Amazing.
So good
They're
news.
vectors, not victims.
Yeah, exactly. Super spreaders.
Audrey says, I'm the mother of 2 boys with special needs. Both are classified as immunodeficient. People keep telling me this virus does not affect children, but is it just healthy children? And are my boys safe? I can't seem to get a straight answer on this, and obviously I'm concerned.
Yeah, so again, it's difficult to answer that question because we just don't have enough information around. But anyone at the moment that is immunodeficient, which includes children who have impaired immune system, we're asking them to take extra precautions. So the term we're using at the moment is to protectively isolate. So people who have impaired immune systems are on chemotherapy, those who are over the age of 75, what we're asking them to do is to protectively self-isolate. So if they were coming into our practice, I'd say at the moment we just don't have enough information. I would play it safe and I'd advise her to protectively isolate her children.
Okay. Good advice.
Chris in Dublin would like to know, what are the recommendations for breastfeeding for mothers with coronavirus? So
the recommendation is to breastfeed. So breastfeeding is the single best thing you can do for your child. I mean, the advantages are huge and enormous, we know that. And at the moment, from the data that we have and the research that Holles Street has just released, it appears that the coronavirus isn't transmitted in breast milk. And as I said, the benefits to breastfeeding to a child far outweigh any other risk. So the advice at the moment is to continue to breastfeed, definitely.
Okay.
Matt, if I have it, what should I take? How do you treat it?
So basically, it's all about managing your symptoms. So if you have a fever, take paracetamol first line. If you have a cough with this, you can take a cough bottle, and you can again phone your pharmacist as opposed to calling into your pharmacist. Simple things like honey and lemon can help with your cough, but it's about managing your symptoms, and paracetamol is the first line treatment we're using at the moment.
Okay, so simple solutions.
Simple solutions. I suppose the single most important thing is, if you do have symptoms, the most important thing you can do for yourself and for others is to self-isolate immediately and to contact your GP.
But the treatments are all treatments that don't require prescription, so you can just get them over the counter.
No, unfortunately at the moment there is no treatment and there is no vaccine, so it's just about managing your symptoms. So if you have a fever, take paracetamol and self-isolate immediately and contact your GP, who'll be happy to give you advice.
Yeah. Rachel wants to know, is coronavirus like the chickenpox? Can we only catch it once in our lifetime?
So again, that's very similar to one of the questions you were asked previously. We don't know. So the coronavirus is a virus, and it's part of the corona family of viruses, which includes the cold virus. And we know that you can get the cold multiple times. So the likelihood is that maybe you may be able to get coronavirus more than once, but we will only know when we've had about a year of data on that.
We don't know enough.
We just don't have enough
at
the moment. No.
We don't have enough exposure to it or experience of it.
No.
But what we do know, and what every single health and medical professional is telling us, is the importance of social distancing, and we can't drive that point home enough, can we?
No, like as the Taoiseach was saying, like as a country we have to come together, but we have to do that by staying apart. Like the single most effective thing that every man, woman and child in this country can do to stop this from spreading or to slow down its spread is to stay apart. And I know that's really difficult. I mean, we're getting calls from parents saying, my kids are crawling the walls, and I get that it's really difficult, but we have a really limited window of about 7 to 10 days, and we have one chance to get this right as a country. We won't get a second chance, and what we need to do is do what countries like South Korea And actually China did was really strictly socially distance ourselves from other people. It's difficult because as Irish people, it doesn't come naturally to us. We're very kind of tangible. We like getting close to other people. But the only thing that works to slow the virus down and that actually stops it from spreading is to social distance. So my one plea to everyone would be to please, please, please put at least 2 meters between yourself and other people, because that is the only thing we can do to give ourselves a chance of getting through this.
Okay.
Matt, we appreciate your time and we appreciate the work you do. We know that you guys are slammed at the minute, and thank you to you and the other GPs, the surgery and all the staff who are there.
Thank you.
We know you're doing your best for all the patients, and keep up the good work. Stay well. Thanks
for having us.
Thank you, Matt.